Welcome to your pre-departure visitor orientation. There are two parts to this orientation. The first will give you some background information about Health and Harmony and our sister organization in Indonesia, Austria. Health and Harmony has been applying the principles of planetary health in Borneo for over 10 years. Our successful approach uses healthcare to heal the planet with win-win solutions designed by communities. These solutions end the cycle of poverty, poor health, and environmental destruction while protecting endangered orangutans and other critical biodiversity. Here's a short video about the work Health and Harmony is doing.
Every single village you were in, you could hear many chainsaws all the time. Illegally logging in the national park. And now, you can't hear them anywhere. And the reason is, we did something crazy. We did what I call radical listening. We asked them what they would need to stop logging. They told us that what they would need would be access to high-quality, affordable healthcare, so they wouldn't have to log to pay for healthcare, and they needed training in sustainable agriculture, particularly in organic farming. We did those things. 10 years later, we had an 88% drop in logging households. It's continued to decline since then, and we've had a drop in under 5 mortality. The environment is healthier and happier and better off, and the humans are healthier and happier and better off. You can pay for your healthcare with non-cash payment options. You can pay with manure, you can pay with beautiful handicraft, and you can pay with seedlings, which we then use for reforestation. That is how people can always access care here now, and that's made an enormous difference because it means people don't have to log to pay for healthcare. We also give discounts to communities that stop logging. Now that discount is paid for by organizations that care about protecting orangutan, they care about the health of our planet. So they are willing to give a sign of thanks to the communities here who are protecting the forest. Sadly, when we started, we had already lost 40% of the forest, and there was rampant logging going on. But since we started our program, we managed to stabilize the loss of primary forest, and it stopped because we did what the communities said. And we have had 20,000 hectares of regrowth forest. We are so excited about replicating this model. There are many other places that we would like to work. We have to learn to live in balance with our earth, and that means we have to protect rainforests. The lungs of the earth are critical for the health of the entire planet. We have to protect them. And the only way to do that is to work together around the planet, but listening to the local communities because they know the solutions for how to protect them. So let's work together and make it possible.
Health and Harmony started in 2007. Our founder, Kanari Webb, was visiting Borneo as a student to study orangutans in 1993, and even back then you could hear the chainsaws in the distance. Over the next 2 decades, Borneo experienced the fastest rate of deforestation the world has ever known, and the Gunung Palung National Park, where we work, lost 40% of its primary forest. Between 1988 and 2002, more than 70% of the lowland forests within the Gunung Palung National Park's 10-kilometer buffer were deforested. Tropical rainforests are important for combating climate change and storing carbon, so humans and animals need rainforests to survive. Kanari decided to come back years later, and in 2007 she founded both Health and Harmony, based in Portland, Oregon, and Austria, our sister organization, based in Sukadana, West Borneo, Indonesia. Kanari and her rainforest biologist husband, Cam Webb, teamed up with dentist Dr. Hotlan Umpusunggu, and together with a team of dedicated Indonesians, they held more than 400 hours of meetings with communities around the Gunung Palung National Park. Using a process that Kanari calls radical listening, these meetings led to a blueprint for healthcare and conservation programs that actually worked in harmony with each other. The fundamental concept of health and harmony was born. You will be visiting Austria, and Health in Harmony is helping you prepare for your visit. What is planetary health? In order to be healthy, we need all of our ecosystems to be healthy. Our mission is healthy planet, healthy forests, healthy people. We embody the concept of planetary health by looking at ecosystem health as a whole. If the planet is not healthy, the people are not healthy. We're working to integrate planetary health with medical health in collaboration with the Planetary Health Alliance, a consortium of almost 200 nonprofits and education institutes that are collaborating to advance this field. Through our education exchange program, participants gain hands-on experience in the emerging field of planetary health. What sets us apart is the opportunities to make genuine connections. We offer community-based experiential learning, where participants can shadow patient visits in the hospital, harvest vegetables alongside farmers, or co-create a business plan with a former logger turned entrepreneur. You will have the unique opportunity to see planetary health in action. Radical listening is a methodology used to facilitate community design solutions. The causes of deforestation can be complex. To protect rainforest ecosystems, we depend on the wisdom of the people who live there. Local and indigenous communities are the experts, so we practice what we call radical listening, asking communities what they need to protect their environment and investing exactly in their solutions. In over 400 hours of meetings in villages all the way around the park, we ask this question: you all are guardians of a precious rainforest that is valuable to the whole world. What would you need as a thank you from the world community so that you could protect the forest? And then we listened. Radical listening's strength is found in group conversations, putting the power of brainstorming a solution in their hands. At Austria, we offer both high quality and affordable healthcare, sustainable livelihood programs, reforestation, conservation outreach and education, and monitoring and evaluation. We want people to have access to great healthcare, empowerment to abandon illegal logging as a source of income, healthy rainforests to live in, and knowledge to share. Lastly, we pay close attention to monitoring and evaluating our programs to ensure our success and to make improvements as needed. Austria provides high-quality care with all Indonesian physicians who receive training opportunities at top universities like Rochester, Yale, and Stanford, and who also have the opportunity to exchange knowledge with visiting foreign physicians. This means not just high-quality healthcare, but capacity building for local communities. Austria's clinic is different from other clinics because we accept non-cash payment options. This can be in the form of seedlings that are then used for reforestation, handicrafts, rice husks, or animal manure, which is used for composting, or patients can work in our organic garden located behind the clinic. In addition to that, we provide incentives for entire villages to stop logging. We work with park rangers and park guardians to monitor which villages have a lower percentage rate of logging families. Once an entire village has stopped logging, they sign an agreement, which in turn gets them a 70% discount for healthcare services at the Austria clinic. We also work with families who have stopped logging to help them identify an alternative livelihood. We then help them make this a reality. Whether it be a juice shop or a grocery store, we ensure that by giving up logging, they still have a way to make a living. Our chainsaw buyback program is a great example of this. We work with forest guardians to identify which families are still logging, and then we thoughtfully approach them and ask them if they would be interested in selling us their chainsaw and learning about an alternative livelihood instead. The buyback ceremony is extremely empowering, and we make sure to include the entire family, wife included, in the conversation and decisions as a way to empower everyone. Our monitoring and evaluation work shows that this program has saved over 1,500 old-growth trees since 2017. Another alternative livelihood program is the Goats for Widows program. Traditionally in rural Borneo, wives whose husbands have died are left with few options for making a living, making them more vulnerable members of the community. We have a male goat that rotates through the villages, and once the widow has multiple baby goats, they are invited to give a baby goat to another widow. The goats are profitable as they can be sold for meat, and their manure can be used as fertilizer. This is another example of community building in our programs. We have also reforested over 2,000 hectares of land at our 3 reforestation sites from donated seedlings as a clinic services payment. There are 2 divisions within the Health and Conservation Education Program, the Community Education Program and the Austria Kids and Austria Teens Program. Community education sessions are usually delivered to patients in the waiting room twice a week and through community education nights in the surrounding villages. Austria Kids is a conservation education program that empowers youth to take pride in their rainforest and gain awareness of the threats it faces. When the first Austria Kids session ended in 2012 and plans were made to expand the program, a group of Austria Kids graduates wanted to stay involved. In 2015, the group started Austria Teens. In exchange for helping with the Austria Kids and getting involved in other Austria projects, Austria helps the teens organize field trips to local conservation and ecological sites. In 12 years, we have seen an 89% reduction in households that report logging for a living, 67% reduction in infant deaths per 100 households, and 50,000 acres of secondary reforest regenerated. Over 10,000 participants and patients were educated in health and conservation. We think Austria is special in many ways and that we have an important story to tell. We value interconnected programming, healthcare with reforestation, to highlight that we are all in this together. This is why we encourage visitors to see the work in action for themselves. Health and Harmony is starting new sites in Brazil and Madagascar to protect more tropical rainforests, consider the lungs of our planets, improve health and economy for traditionally marginalized communities, and also to understand the key elements of this success so it can be quickly scaled around the world. You will learn more about Health and Harmony's replication model and learn more about setting up a healthcare and conservation program. The second part of this orientation will now go over what you can expect about your visit to Austria and Sukadana. Sukadana is a small town on the western coast of Borneo. It's a beautiful place, known by few as the gateway to the Gunung Palung National Park. Once you arrive at the small airport in Ketaping, an Austria driver will greet you. It will be easy to find him in the small airport, and typically there are not that many tourists arriving in Ketaping. If you are delayed or need to make an update on your arrival, please send a message to Noor or Eti via WhatsApp. Please pause this to write down their contact information. From Ketaping, it is a 2-hour drive to Sukadana. All of our visitors stay with Austria staff to get a local homestay experience. Your bedroom is equipped with a mosquito net, but the housing is quite basic. A bath or shower is called a mandi in Indonesian. Each house will have a large tank of cold water in the bathroom and a small bucket. A mandi is customarily done by scooping water over your body with the bucket, soaping up, and then rinsing off. It is customary to bathe twice a day, in the morning and at night. Most houses have squat toilets, which you flush using water from the large tank. If you choose to use toilet paper, you do not throw it in the toilet, as pipes clog very easily. Instead, toss it into a trash can. There is a hired helper who will make dinner on weekdays, do your laundry, tidy up, and clean around the house. The housing experience will be a great one as you get to know other visitors and staff in the evenings. You are expected to acquire breakfast on your own. There is a small breakfast spot next to the clinic where most staff get breakfast. It is great food for extremely cheap. There is also small grocery stores where you can purchase fruit and oatmeal. Please keep in mind that Western food is hard to find, so please bring snacks if you anticipate this being an issue. Lunch will be provided at the clinic on workdays. As mentioned, dinner will be available at your housing during weekdays. Indonesian cuisine is predominantly rice-based, with meats and vegetables cooked in rich, flavorful sauces. Proteins include seafood and chicken, and on occasion, beef and goat. It is not hard to find good vegetarian options, as most meals will include freshly made tempeh or tofu, eggs, and/or vegetable dishes. There will be a wide array of seasonal fruits, though fresh salads and other raw vegetables are not very common. There are not many cars in Sukadana, so your main mode of transportation will be a bicycle that will be provided by Austria. You will also receive bike lights and a helmet. You may want to bring a headlamp, though, as it gets dark early, being so close to the equator. Your housing is very close to the clinic, so the bike rides are very short. Always let someone know when you are leaving and when you have arrived at your destination. We do not allow visitors to bike home alone at night. Sometimes an Austria staff will accompany you if need be. Please do not carry valuables around with you, as petty theft is rare but can occur. You may ride in a car when visiting Austria programs that are further away or when traveling to go on a hike. As you would in any location, all visitors are reminded to wear their seatbelts at all times when traveling by car. Depending on your project design, your main point of contact will vary. For medical visitors, you will be working closely with Austria's clinic manager, the conservation manager for forestry and conservation work, and the communications manager for photography and marketing projects. All overarching visitor needs should be reported to Eti. She is your liaison during your entire stay. If you are a medical visitor, please be aware of the patient treatment prohibitions. The Indonesian doctors are legally responsible for diagnosing and treating patients. You serve in a purely advisory capacity. Your visa allows for only the exchange of information and cultural learning, not for practicing medicine. You can help with procedures if need be, but in a teaching capacity only. For example, if there is a complex wound to suture and you are the most skilled available, it's okay for you to do the suturing, but to teach others how you do as you go along. Likewise, it is okay to provide direct emergency care if needed while teaching the team around you. Please do not hesitate to ask an Austrian physician if you are unsure of what you are allowed to do. They are more than happy to clarify any questions. Please be sure to make an appointment at your local travel clinic to receive the most recent information regarding vaccines and disease prevention methods. Malaria risk is pretty low, but there are other diseases to be on the lookout for. Mosquito nets are provided, but please bring bug spray and proper clothing to protect yourself as much as possible. Make sure to save the medical insurance ID policy and phone numbers for emergencies. The medical insurance company is a great resource and will be there for any issues you may have. We are currently training our staff on medical evacuations, but our insurance company will be able to walk you through what to do in any situation and can refer you to the nearest quality hospital. Please call Global Gallagher Assist if you require a referral to a hospital or doctor, you're hospitalized, you need to be evacuated or repatriated, you need to guarantee payment for medical expenses, you experience local communication problems, or your safety is threatened by the sudden occurrence of a political or military event. Of course, always get yourself to a safe location first and notify an Austria staff member as soon as possible. Although it may be tempting, please do not go swimming in the ocean. Box jellyfish are common and extremely dangerous. The beach is a great place to visit, and there are many great restaurants and juice shops along the beach. Although the weather is hot and humid, people in the region dress modestly. Respect for communities is an important principle at Austria, and accordingly we ask all visitors to observe local norms and to also wear conservative attire. Both men and women are asked to wear nicer clothes in the clinic and should wear pants or long skirts and shirts that cover the elbows during work hours. Fieldwork clothing can be a bit more casual, but it is still required to cover your elbows. During your free time and on hikes, short-sleeve shirts are acceptable. Loose fitting and full coverage is a general standard to set when thinking about what to pack. Please be sure to bring shoes that are easy to take on and off, as you will be expected to take your shoes off when entering the clinic and housing. Also, don't forget to bring rain protective gear and clothes and boots to hike in. We also recommend bringing clothing that you are comfortable relaxing in and around the house for time spent at home. As far as other cultural expectations, starting a romantic relationship with staff is strictly prohibited. We are respecting the local culture by having all visitors not share a room with the opposite sex unless they are married, and signs of affection in public is not well received. As far as alcohol, Sukadana is a dry town. You will not be able to find alcohol there. You are allowed to bring your own alcohol, but it must be drank in the privacy of your own room, never in public. If visitors are publicly intoxicated, Health and Harmony and Austria can send you home following the code of conduct. It is common for visitors to give the Austria staff a small gift from their hometown. This can be anything that is unique to your home and exciting to the staff, such as candies, smoked salmon, or chocolates. There are about 35 staff members at Austria, and the gift should be given at lunch for them to share out with the rest of the staff. Try and reduce gifts that are wrapped in plastic, as Austria limits the use of plastic around the clinic. Shake hands and nod when meeting someone. If you are a man, only shake hands when the woman initiates the greeting. Indonesians are known for their generous hospitality. Keep in mind that refusing an invitation could be taken as a personal rejection. Lastly, always pass things with your right hand. Electronics and technology. Please note that Wi-Fi is available but very limited. Most visitors get a local SIM card at the Jakarta airport, which provides them with cellular data and a mobile Wi-Fi hotspot, but we also ask our visitors to be comfortable being unplugged a bit while visiting Austria. We also want to remind you of the humidity levels in Sukadana. Most technology handles the humidity fine, but it is important to think about when packing nice cameras and laptops. Photography. We warmly ask our visitors to feel comfortable taking photos of the programs at Austria. We'd love for you to share your work with us so we can use the images for our marketing and social media materials. Photo credit will always be given. When entering a new community, please be respectful of the people you are photographing and make sure it is okay. We do the same for you. If you do not want the patients at Austria or staff to take your photo or use it on their social media, please let them know. If you are out in public and someone is taking your photo and you would like them to stop, the sentence for "Sorry, I don't want you to take my photo" is on the screen. Please pause this again and write down this sentence if you think you'll be interested in saying it. As far as the ATM and money situation, you will not need much cash in Sukadana, mostly for breakfast and any little tokens you'd like to buy as souvenirs. An overview of daily costs can be found in the visitor guide. There is no reliable ATM in Sukadana, so it is best to get cash out at the airport. If you want to go on a trip or guided tour, Austria can help you book the travel and you can reimburse them by paying in cash or through an online payment, the same way your visitor fees were paid. This is a checklist to make sure that you are set to go. You have your visa, you've paid your visitor fees, you've filled out the pre-survey, you've visited your local travel clinic, you've saved all important contact information to your phone, and lastly, reviewed the safety and security documents. Don't forget to refer to the visitor guide in the portal, but let us know if you have any outstanding questions by emailing noor@healthandharmony.org. That's Noor. Thank you for listening.